9 easy ways to lower blood sugar levels naturally. 1. Keep an eye on your carb intake. Paying attention to carbohydrates is important for people with type 2 diabetes. Carbs are what cause your blood sugars to potentially fluctuate, Crandall-Snyder says. How many carbs per meal is ideal? It's tailored to each individual, says Weissenberger. How much you exercise, your weight, and your age can all affect how long sugars stay in your system, according to the CDC. A typical starting point for people with diabetes is to limit carb intake to 200 to 245 grams g per day, which amounts to about 1/2 of your daily calories coming from carbs, according to the CDC. From there, make adjustments according to your blood glucose readings or as recommended by a dietitian, Crandall-Snyder says. And keep in mind that carbs aren't only found in the usual culprits, like bread, potatoes, and pasta. They are also in fruits, vegetables, sweets, and dairy. So you have to take all of those into consideration as well, Crandall-Snyder says. 2. Avoid eating large meals. One way to keep carbs under control is by eating in moderation. I always tell my patients to spread their food out over the day, Weissenberger says. Don't eat small meals to save up for a big dinner. Feeding your body throughout the day helps regulate your blood sugar levels and prevents highs and lows, Crandall-Snyder says. Both Weissenberger and Crandall-Snyder say to keep an eye on carbs, even while snacking. Classically, less than 15 grams of carbs per snack is a good standard approach, Crandall-Snyder says. That's about what's found in 1 cup of fruit, she says. 3. Fill up on fiber. Fiber is another nutrient you'll want to keep an eye on for blood sugar management, but in this case, the more the better. It can help stabilize your blood sugars, Crandall-Snyder says. It also plays a role in weight management and can lower your risk of cardiovascular disease, according to a review published in September 2017 in Advances in Obesity Weight Management and Control. Fiber plays a preventative role too. Studies have found that high-fiber diets can reduce the incidence of type 2 diabetes by 15 to 19% compared to low-fiber diets, according to a March 2018 study published in the Journal of Chiropractic Medicine. You'll find fiber in plant foods such as raspberries, peas, and whole grains, according to the Mayo Clinic. Beans are another good source of fiber. People with type 2 diabetes who ate at least a cup of legumes, beans, chickpeas, and lentils daily for 3 months had lower blood glucose levels as measured by the A1C test, according to a study published in the Archives of Internal Medicine. A1C is a way to measure your average blood glucose levels over a 3-month period. According to Medline Plus, beans also are an excellent source of folate, which is linked to a lower risk of cardiovascular disease, a common diabetes complication, according to the National Institutes of Health. Men should aim for 30 to 38 grams of fiber per day, and women should eat 21 to 25 grams per day, according to the Mayo Clinic. 4. Get more Quality Shuteye. Poor or limited sleep affects body chemistry, and getting more slumber helps with blood sugar control, Weissenberger says. Chronic lack of sleep may contribute to the risk of type 2 diabetes, according to a small study published in Diabetologia in February 2015. Healthy volunteers who slept only 4 hours for 3 nights in a row had higher levels of fatty acids in their blood, which reduced insulin's ability to regulate blood sugar by about 23%, the researchers found. Lack of sleep is also linked with other health conditions, including obesity, heart disease, and stroke, according to the Division of Sleep Medicine at Harvard Medical School. The National Sleep Foundation recommends aiming for 7 to 9 hours of uninterrupted sleep per night. Having sleep troubles? Follow these recommendations from the National Sleep Foundation. Sleep in a cool, dark room. Avoid consuming alcohol or caffeine during the hours before bed. Go to bed and wake up at the same time each day, even on the weekends. Don't look at screens for at least a half hour before bedtime, including TV, tablets, cell phones, and computers. 5. Lose a little weight. Carrying around extra weight is one of the main causes of insulin resistance, keeping the blood sugar-lowering hormone from working properly, according to the National Institute of Diabetes and Digestive and Kidney Diseases. Your weight loss goals don't have to be enormous either. Some of Weissenberger's patients have seen improvements in blood glucose readings with only a 5-pound loss, she says. Makes sense. A study published in the American Journal of Preventative Medicine found modest weight loss, losing 5 to 10% of body weight, resulted in improved insulin sensitivity and glucose tolerance. Small steps in the right direction can yield big results in improvement or prevention, Crandall Snyder says. 6. Drink more water. Staying hydrated is an easy way to stay in control of your blood sugar levels. A previous study found the more water study participants drank, the less likely they were to develop high blood sugar. More specifically, the study found people who drank less than 1/2 liter of water per day were at increased risk of developing blood sugar issues. The idea is that water helps flush glucose out of the body. Having a glass of water can be really helpful in essentially diluting your blood sugar and lowering your blood sugar in a healthy way, Crandall Snyder says. 7. Get a handle on stress. When you are stressed out, your blood sugar tends to rise, Crandall Snyder says. According to the Diabetes Teaching Center at the University of California in San Francisco, when you're stressed, insulin levels fall, certain hormones rise, and more glucose is released from the liver, which ends up in the bloodstream and can cause disruptions for up to 8 hours. How can you burn off tension? Yoga and meditation can help people lower their blood sugar levels, Weissenberger says. A December 2014 study published in the Journal of Physical Therapy Science involving 27 nursing students found a combination of yoga and meditation practiced for 1 hour once a week led to reduced levels of stress and lower blood glucose levels after 12 weeks. Crandall Snyder also suggests taking a few deep breaths, going for a walk, playing with your dog for a few minutes, or listening to a fun song. Basically, whatever you can do to distract yourself for a few minutes and just lower your breathing rate will help, she says. Indeed, the CDC notes that less water in your body is linked with a higher blood sugar concentration. 8. Never skip eating breakfast. We've all heard that breakfast is the day's most important meal. This is especially true for those who have diabetes. I think eating breakfast is important, especially with potential risk for hypoglycemia and avoiding potential highs related to fasting for too long a period of time, Crandall Snyder says. A high-protein breakfast has an edge over breakfasts that are high in carbohydrates, according to research from the University of Missouri-Columbia. In the research, women ages 18 to 55 consumed meals with similar calories, fat, and fiber contents, but differing amounts of protein. Researchers monitored the amount of glucose and insulin in the participants' blood for 4 hours after they ate breakfast. The best breakfasts contained 39 grams of protein and led to lower post-meal glucose spikes than the meals with less protein. The researchers found 9. Add more resistant starch to your plate. Resistant starch, found in some potatoes and beans, bypasses the small intestine and ferments in the large intestine, which means it doesn't raise glucose levels and promotes the growth of good bacteria in the body, according to Johns Hopkins Medicine. It's a fiber-filled starch and helps with glycemic control, says Joel Malinowski, RD, a certified diabetes care and education specialist with Ellis Medicine in Schenectady, New York. And the effect will last through your next meal, Weissenberger says. It's called the second meal effect, she says. What do you think of our video? Let me know in the comments section below. Before you go, please hit the like button and subscribe to my channel. Thanks for watching. Comments.